Hi, it's Dr. Carr here, and I am going to perform a physical exam on a dog. I'm going to start by saying hello, kind of getting to know the pet. And in this case, I'm doing the exam on the floor, but you could also do the exam on a table. So this is Kaz, and she's very excited to be here and be a part of this examination. So when I perform a physical exam, I like to be consistent and start from the front and move to the back of the animal. An exception to this would be if the pet was showing me signs of fear, anxiety, or stress. That's FAS. And I may adjust my exam protocol if the animal is not feeling comfortable with what I'm doing. So when I start the physical exam, I'm going to start with the head. I'm going to look at the nose and look for any signs of dry, cracked nasal planum, and that's the leathery part of the nose. You will notice the nasal philtrum is that line that kind of divides between the nostrils and the lips. That's the nasal philtrum. I'm looking for any discharge or exudate from the nose, any crusts or sores. I'm looking to see if the eyes are symmetric, that neither one of the eyes is bulging or sunken in. I take a quick look at the eyelids to make sure there's no growths on the lid margins, to make sure that the eyelid margins are not rotated medially, which is called entropion, or rotated outward, which is called ectropion. I take a quick look at the whites of the eyes to make sure they're not red or bloodshot or yellow that might suggest liver disease. And make sure I just real quickly, with a closed eyelid, give a little touch to the eye or the globe to make sure that it's not firm or painful. I check for any swelling along the face, make sure both sides are symmetric. I look at the chin for any sores. It's very common to get little pustules or papules on the chin that would suggest acne or a skin infection. I look at the commissure of the lip, and that's where the lower and the upper lips meet. And then I stretch them and have a quick look inside the mouth to see if she has any dental disease, and she does have a little calculus, a little gingivitis. I also make note of her occlusion, and she does have a mild malocclusion where her upper and lower teeth are contacting, and the wear there is called attrition because it's tooth-tooth contact causing the wear. And the gums are nice and pink, so I do make a note that they're not cyanotic or purple, they're not gray, and they're not pale or white that might suggest anemia. I usually, if I trust the dog, take a quick look inside the mouth, make sure the tongue looks normal, and that there are no major abnormalities. I do also make a note of any halitosis, and she does have a little halitosis. Okay. Back to the eyes for just a second. The medial canthus of the eye is the medial corner. The lateral canthus is the lateral corner of the eye. Okay. I also feel her temporal muscles. The temporal muscles, one or both, can be atrophied in certain disease processes. I have a look at the ears. So I have a look at the pinna, make sure that there's no sores or scabs or crusts along the pinna. I kind of flip the ear over and see if the skin is nice and light pink or if there's any debris, odor, or redness. And of course, I'm watching to see if the pet is itchy or resistant to having the ears touched during the exam. I do the same thing for the other side. And then I go ahead and feel along the jaw, make sure there's good symmetry, and then I feel the submandibular lymph nodes, the prescapular lymph nodes, and then I reach on back and feel the popliteal lymph nodes behind the knee. Make sure that they're not enlarged. Popliteal, prescapular, and submandibular. And then I usually just tilt the head up very slightly and run my fingers along the trachea. This is called the thyroid groove. And feel if there's any masses in this area. A big mass in this area could be a sign of a thyroid tumor or a thyroid mass. Okay, and then I put just the slightest amount of pressure on her trachea to see if she gives a cough, and she does not. But tracheal sensitivity could give me an indication of something else that's going on. And then I just kind of feel her along her back Make sure that she doesn't have any pain or discomfort. And then I kind of support under her belly and feel gently, palpate her abdomen to make sure she's not distended or painful. And then I just run my fingers along her mammary chain on both sides. They have 5 sets of nipples or 10 nipples total. Make sure that there's no tumors or masses that might indicate malignancy of some sort. And then I go ahead and quickly feel the joints for range of motion and for symmetry. I feel between the toes and I have a quick look at her toenails to make sure they're healthy. In her case, they're painted from Easter. And then I do the same thing with the back leg. And your dog in the veterinary clinic should have a proper restrainer. This is my own dog and I know her, so I feel very comfortable doing her exam. Again, feel in between the toes. Look at her pads. Feel her major joints. On the back legs, I usually take a quick feel to make sure the kneecap isn't luxating or rotating out of position. So I'm going to repeat that for the other side. Take a quick look. And then the other side, same thing. Just kind of feel her joints. I give a quick look at her body condition score. And if you could come from above and look down, body condition scores can be on a scale of 1 to 5 or 1 to 9. I like the 1 to 9 scale. And our body condition score should be a 5 if it's normal. And so I can feel the ribs but not see them. I can feel the spine if I push down, but I can't see it. And there's not an extra amount of fat. And if you look from above, she has a waist. She's not a barrel. She kind of has a waistline. So she's a 5. So she's in good body condition score. I take a quick look at her integument. I've already looked at her skin in several locations, but I'm looking for any signs of bald patches or alopecia. I'm feeling with my fingers for any scabs or crusts that might be present. And skin feels pretty good, looks pretty good. And then the last thing I usually do, actually not the last thing, I'm gonna go ahead and do my auscultation of the heart. And so I usually start on the left side, right here, her left. And then I move to the sternum. And then I move to the right side. Okay, and when I'm auscultating the lungs, I do all 4 lung fields on both sides, left and right. So here we'd start dorsal cranial, dorsal caudal, ventral cranial, ventral caudal, and I'd repeat that on both sides. I also take a quick listen with my stethoscope to her abdomen to see if she has normal gut sounds or borborygma. Okay. And while I'm auscultating, I take a heart rate and a respiratory rate, listen for any murmurs. Last thing I usually do for the physical exam is the examination of the perineum and the external genitalia. So the perineum is the space between the anus and the vulva, or the scrotum in the boy. And so I look at the anus, and it's normal for the anus to kind of move a little bit in response to stimulation. I'm very careful not to extend the tail too high to hurt her, but I look for any growths. I would perform a rectal exam with a proper restrainer. I'm not going to do that today. And I look at her external genitalia. Her conformation for genitalia is normal, where you can see the vulva and there's no skin fold here. Some dogs have a big skin fold and the vulva kind of hides in the crypt, and that's called an inverted vulva. It's very important to look for that because that's a skin fold that could cause a problem for the pet and require some maintenance for the pet owner. One more thing that we usually do is a flea combing. I don't have a flea comb today, so if I don't have a flea comb, then I just part the hair And I usually go over the chest, over the shoulders and over the tail head here, over the rump and over the shoulders, because that's the most common location to find a flea. And if you don't have a flea comb, then you just kind of part the hair, kind of part the hair and look for any signs of debris or any moving critters as you go through, okay? I'll do the same thing over the rump. Okay, but flea combs are really nice and they're pretty effective. If they have fleas, you usually find them. And that concludes our brief physical exam today.